Hello, this is Dr. Herdig with CORE Chiropractic. Now, I get asked all the time by new patients, why do we take x-rays of the neck? I'm not having a neck problem, I'm having a back problem, or it's why is it that some chiropractors take x-rays and others don't? Well, I'm here to answer that question for you. For one, why do we take x-rays on every single patient? Because we necessarily don't know exactly what's going on. We need to see exactly where that curve is at into the neck. So if we look here from the side, what we want to see here into the neck is a 35-degree curve. That 35-degree curve is really important. It allows for gravity and the weight of our head to be pushing on those disc spaces evenly and appropriately, because when it's not and we have forward head posture or we've lost that curve, there's more gravity that's pushing on those disc spaces and it wears down over time, and that causes degeneration. And then when that degeneration happens and there's less space here on these nerves from the neck, it's going to put pressure on those nerves. And that's what's really causing all of our pain and all of our discomfort. Now here at CORE, what we do is we actually take 3 separate x-rays of the neck. What we'll do is we'll take an x-ray of the neck from the lateral side here. That's going to show us the curve and really where those disc spaces are. We're going to take an A to P x-ray here. Okay, this is going to show us, is there any rotation of those bones and of the vertebrae, and how do we need to adjust? And then we'll take one through the mouth called an APOM, or an AP open mouth. That's here. That's going to show us the first and second bone that come directly off of the skull. Now, if there's rotation or any compression on C1 or C2, which is the first and second bone off of the skull, that's going to put pressure on the brainstem. That's going to cause headaches, migraines, sinuses, allergies, brain fog, a lot of symptoms that people are actually coming in and experiencing. Now, that is the reason that we also always take x-rays on these patients, is because we're actually checking for things that people aren't experiencing yet. With the use of cell phones and the use of computers and people always sitting on desks, these are things that we're continuously seeing happening more and more and more and more, and we're trying to prevent them from happening and also prevent people from feeling those symptoms. Now, if we take a look here at the chart, remember what I said C1, C2 is the first 2 bones that come off the skull? Look where these things go, okay? It's going into the head, it's going into the eyes, it's going all the way down into the neck. It's affecting posture, but it's also going into the jaw. So many people, just due to stress, are going to have issues into that area because they're clenching their jaw, especially at night, just due to accumulation of traumas over time as well. So that's why we take x-rays on everybody, especially into the neck, because there's so many things that we need to get the brain communicated to the rest of the body so that the body can heal itself. And we have to see exactly what's going on so we can make sure that not only are we helping with your discomfort, but your improved quality of life, so you don't have to deal with these issues into the future and prevent them from even happening into the first place. If these are things that you're experiencing, or you think, wow, like that's something that I really want to see, come to CORE Chiropractic. Let's give you an exam. Let's take those x-rays. Let's go over them. Let's see what's going on and make sure that you can live your best life ever. We only get one body. We might as well treat it well.